I'm really excited to be able to clear up some things that I was confused about that I want you guys to know. Hey guys, it's Kelly from Chronic Illness Reality, and I saw my neurotologist yesterday, and I'm really excited to be able to clear up some things that I was confused about that I want you guys to know, especially if you're watching my videos and you're following along and you have Meniere's disease. So, to start off with, just to make sure we're all on the same page, so you guys know a little bit about me, even if you're new here, I have Meniere's disease in my right ear. Meniere's disease is the disease of the inner ear. I also have other chronic illnesses, but we'll just stick with Meniere's disease for now. I have been talking about my Meniere's experience, but I didn't understand the full picture until I saw my neurotologist yesterday. But to clarify, a neurotologist is an ear, nose, and throat doctor or otolaryngologist that specializes in the ear. So oto is in there. Oto is Latin for ear. I saw my neurotologist yesterday and I had a lot of questions because when I had my most recent treatment, the gentamicin injection, in December, I responded a bit differently than I have seen some of you all responded in your videos and things that you've shared with me. And so I thought, what's going on here? And so that's why I talked to my doctor about it, and I want to be able to clear this up. My neurotologist said that my experience is different than what probably your guys's would be. April of 2016, when I had my second gentamicin injection, was actually very similar to my latest experience with gentamicin here in December of 2016. So when I had the gentamicin those two times, I did not get hit by the gentamicin or affected by the gentamicin for 9 days. That's a long time, and it's longer than it should be. So it took 9 days for it to hit me, and then when it hit me, it was very hard. I've talked about it in other videos, and I just had a really rough time. It took a couple months for me to be able to really walk again. I am 11 weeks post-injection, and I am still falling over. So yes, I probably should have had vestibular rehab sooner, but my husband was in the middle of his busy season. To schedule these appointments and get to all of them, it was almost impossible in the middle of him working really late. Hopefully I'm going to be starting with vestibular rehab soon, and that should significantly help with my disequilibrium issues. So I'm looking forward to that. If you have vestibular disease and you have Meniere's disease, the other thing that's extremely important for us to know that if you are on a benzodiazepine, whether it be Xanax, alprazolam, or Valium, which is diazepam, it will affect your vestibular system. So the reason that my body had such a hard time, and the reason I still have disequilibrium, is basically because I'm taking daily diazepam. A lot of people use diazepam and helping their vertigo, and it's something that I'd used in the past to help my vertigo. However, I had been on anti-anxiety medications because I was having panic attacks and PTSD, and I was trying to recover from that. Something really big happened in my life, and as I was trying to recover, the psychiatrist I saw at the time started me on medication. Taking benzodiazepine daily, it affects the way our vestibular system functions. You know, it affects the vestibular tests that I would take. And there's hope that if I get off of this diazepam, that I will be able to kick this balance issue that I have. So there's a lot of hope for me that if I do the vestibular rehab and if I stop the diazepam, I will be able to regain my balance and I won't have this problem anymore. The problem is the reason that I'm still on the medication right now is even though I don't have anxiety disorder anymore, my body went through such severe withdrawal. Yes, there are people that become addicted to them, and then the rest of us have become dependent, and dependency is very different than an addiction. Dependency means that our body needs the medication to function. And unfortunately, I've been on it long enough that I need it to function. And with dependency, I found that it's been frustrating because I didn't realize that my body was dependent until I tried to switch from Xanax to which is alprazolam, to Valium, which is diazepam. I made the switch in 2015 because I wanted to have better control over my vertigo. Now, I know some people use alprazolam for vertigo. It never helped me. So I thought that why not help both my anxiety and my vertigo and go to diazepam. I have an extremely hypersensitive central nervous system. And so, unfortunately, I could not tolerate the switch. My body completely freaked out. I went into full withdrawal. And it was really, really challenging. I was switching from alprazolam to diazepam, and they didn't wean me onto it, so it was a really harsh thing. I ended up in the hospital for just a day. It wasn't very long, but it was because, I was having trouble breathing and very frustrating. I was very upset with my doctor because I felt like my doctor, when I was very vulnerable and going through these panic attacks, he did not educate me on the fact that I might become dependent on it and that my body would get used to this medication. Now, people might say that's a no-brainer, but it wasn't for me. I didn't know, and I feel frustrated at myself because usually I do a lot of research and know a lot about what my issues are and the medications. But at that point in time, I was going through such a difficult time. If you've ever had panic attacks, if you've ever had PTSD, you know what I'm saying. Earlier in 2016, I tried to stop and get off of the diazepam with my psychiatrist's help. He was going to have me go off of it faster, but I knew my body would probably freak out if I went that fast, so I went slower. Unfortunately, what happened is that my body could not tolerate the speed at which we were going off of, and I went into severe withdrawal. I was stuck alone in my bedroom for 2.5 months because I was going through the severe withdrawal, and I refused to go back up on the medication. If I increased my dose, I probably would have stopped withdrawing, but I refused to do it because I didn't want to be up on them. I wanted to get off of it and wanted to stop it. It just made it harder because I was in bed for so long, and then I already have chronic fatigue. I already have health issues that require me to use a wheelchair, and it just really affected my stamina. That was a huge thing, is that my stamina, because I was in bed for so long with the withdrawal, and I had the withdrawal while my vertigo was better, so I missed out on all that time when my vertigo was better from the gentamicin injection I had back in April. I had about 6 months of vertigo-free time, and about 2.5 of those months were taken to the withdrawal. So I was in bed for a long time, and then it was really, really hard for me to get out of bed. My body was shaking for a month because my muscles just weren't used to functioning. It was, and I didn't tell anyone. I didn't know how to because it was so hard to go through it, and it was a very upsetting thing for me. Yesterday, when I was talking to my neurologist about it, my doctor, I just started sobbing. Oh, I was so embarrassed. And I feel like crying right now, honestly. I have a really, really sensitive nervous system, and it's caused me a lot of problems and other health issues. And I'd give anything to be off of this medication. I hate the way it affects me, and I hate that it's affecting me vestibular-wise. I'm going to speak with my neurologist because my neurologist knows my body the best, and I'm going to see what he is going to say about how to get off of it, because my body just cannot take a really fast withdrawal. And I want to be functional. I want to be able to live life while I'm withdrawing. And I have so many other health issues that are affecting me at the moment that I need to live. I want to live. I don't want to go into withdrawal that's completely debilitating again. It's hell. I'll just say it. It's hell. Sorry. I mean, sorry if you don't like the word, but it's the truth. It was hell, and I know I can do it. So I see my neurologist on Friday, so we'll see how that goes, and then I need you guys to cheer me on through this because it's going to be a challenge. If you are taking any of these medications 24/7, it's going to affect your vestibular system. So that is the important thing that I needed you guys to know. If you ever need to take these medications, try to be PRN. Now, if you really trust your doctor and you feel like you guys are doing the right thing, go ahead and do it. I really felt like I was doing the right thing for a while. For my body, and everybody's body is different. I've talked to my neurologist, and sometimes people are on diazepam because it can help with neurological issues. So it's not always this clear cut, don't be on it all the time 24/7, but I wish somebody had told me that because I was on it 24/7. I'm going to be stopping the medication because I don't need it anymore for anxiety. And if I did, there are other medications that I could use to treat anxiety. It's not recommended to stop benzodiazepines right away because you would go into seizures. So don't stop medications. Don't do anything because I'm saying this. Go to your doctor. I'm just another patient. So don't take what I say as any sort of medical advice. I'm not giving medical advice. I'm just sharing what I've learned and what my experience is. If you're worried because maybe you're taking these medications and you're getting them through ways other than a doctor, or you're not, you feel like maybe you have addiction stuff that you need to deal with, go to a doctor. No matter what it is, if you go to an acute care doctor even, you want to make sure that you get the right help. You don't want your body to go into a really, really bad place. And perhaps if it's an addiction issue, then you can get help and support and to go the correct way to be able to not only come down off the medication, but have addiction treatment. Sometimes people get addicted to medications. It happens. But as soon as you know that that's what's happening to you, work your best to talk with your doctors, to talk with people who love you, to get help. Because you're worth it, and you're worth the life that you deserve to live. And if you are dependent on a medication, same thing. I am so glad I can finally tell you guys why my experience is different than maybe your experiences were, because I have been on this medication. So hopefully in the future, when I need gentamicin injection, my experience will be much different. Hopefully I will get off of the medication and be off of it before that happens. I'm really, really hoping. It feels better to finally know what's going on and to have something be able to do something about it. Thank you guys for listening. I really appreciate you all, and I'm thankful. I feel this is a hard thing to share. Obviously, it's a very vulnerable thing to share, but I'm sharing it because I know that there are other people out there like me, and I want you all to have help. I have nothing to lose, and you guys have everything to gain, and I want to make sure that you guys know as much as you can know so that you can get as much help as you need. And so if this helps you, I really hope it does. And if it's something that distresses you, you're not alone, and I'm here, I'm going through it. And also talk with your physician, you talk with your doctors about it. I'm anxious, but I know that life is going to get better, and that's what I keep focusing on, is that there is hope. We've got each other, and we are going to keep fighting. Don't give up. If you have Meniere's disease, you are definitely a warrior. Whatever chronic illness you guys are going through, whether it be Meniere's or anything else, know that you're not alone. I care. There's so many of you guys that are out there and subscribed, and you guys care, and so yeah, if I could give you guys a big hug, I would. So take care, and thanks for listening, and remember, you are not alone. Hey guys, it's Kelly. It is mid-March, so it's a bit jumped ahead from the clip you were just watching, and I have an update for you. So when I was talking to my neurologist, he was going to go ahead and wean me off of the diazepam, he was going to switch me to clonazepam to make it an easier withdrawal. However, I was a little bit apprehensive about I didn't want to go on another medication. I just wanted to get off. I spoke with my neurologist, who is my migraine and headache disorder specialist, to see if he would be willing to help me taper off of the diazepam. The reason that I think he would be the best one to do that is because he actually has helped many people to taper down off of medication. And so there are medications that are not benzodiazepines that require a taper down, such as the antidepressant Effexor, which if you go down too fast on it can have really bad consequences. So whatever medication you're on, you always want to talk about before going cold turkey. So everything that I'm sharing here is personal to me. It's just me relating my experience. Please talk to a doctor if you have any questions or concerns about what I'm saying. I think that it's just really important if you are on a daily benzodiazepine to realize that it probably is affecting your vestibular system, regardless of if you feel like you're experiencing anything or not. So I really highly encourage you guys to talk to your doctors. I just feel like as a patient, I wish I had known the information that I did. I first of all wish I hadn't been so naive. I wish I knew that my body would become dependent on this medication. And second of all, I wish that my doctor had told me that it was going to be hard to withdraw off of it, or possibly hard to withdraw off of it. Thirdly, I wish that my doctor had told me that this was a problem with the vestibular system. So all of those things I hope I'm communicating to you guys. Currently I'm on a 10-week taper off of the diazepam, and because my neurologist knows how difficult it was for me to taper off before, he is willing to go slower if I need to go slower. But at the current rate, we're going half as slow as I did before. So I shouldn't have the significant severe disabling withdrawal that I had before. I am having symptoms of withdrawal, but it's kind of comes with the territory. You know, you're going to have to get off this med, you're going to have to experience withdrawal. So it is what it is. I'm hoping it doesn't get much worse than what it is right now. But I'm hopeful. I'm really hopeful, and I'm looking forward to getting off of this medication and never having to think about it one more time ever again. It will be safe for me to take as needed. So if I were to have a really bad vertigo attack, I could take the diazepam as needed, but to take it on a daily basis is just not helpful. So I'm really happy when this is done. It has been difficult, even though the withdrawal symptoms are expected. It's difficult on top of all the other health issues I'm going through. So thank you guys so much for caring about me and for cheering me on. I'm cheering you on. I would be happy to answer any questions that you have. And again, I am simply relaying my experience. This is not a substitute for medical advice. Make sure you talk to your physician. And remember, you are not alone.